The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon, everyone. This is Rebecca with the Washington Food Industry Association, and thank you for joining our weekly update webinar. Just a few things before we get started. If you are on the call and you have the ability, please mute yourself because as we get to the question portion, we unmute everyone and there's always a lot of background feedback. So definitely make sure that you have clicked on the mute button on your end. So when I unmute people, we won't hear all of that. And also, if you have to get off or take another call, please do not put us on hold because then we get to listen to everybody, listen to your hold music. So with that, I will turn it over to Jan.
So, Rebecca, would you explain to them along the way how they can ask the questions in the question box or the chat box?
Yeah, so if you have questions at any time, you can enter them into the question box, which should be right there in your panel on the right-hand side or whichever side of the screen you put it on. Or if you know that you're going to have a question, you can also click on the little hand raise button and we'll know that you want to speak to have a question and we'll unmute you so you can talk.
Thank you. Okay, I'm Jan G., President and CEO of the association, and welcome. We're glad to have you all here. And we do have a guest speaker today to talk about a new proclamation that was issued by the governor on, excuse me, Thursday, I think it was last week, Thursday or Friday, Thursday, that is called Phase 2 Food Establishment Operations Overview. And this is going to impact your eating areas. And so I have invited Susan Shelton, who's from the Food Safety Division of the Department of Health. And some months down the road here, you'll probably be hearing from Susan too on our food code webinar, as Susan is the lead on coordinating all of the activity, the stakeholders, the comments. Oh my gosh, it's extensive. And so she will be helping us with all the new changes in the food code and give us guidance. But today, she's going to talk to you about how you are impacted when Phase 2 kicks in. Many of you are in Phase 2 right now, and we still don't have statewide Phase 2. So Susan, thank you very, very much for being with our members today. Appreciate it. It's all yours.
Great. Thank you, Jan. I'm actually very excited to be here. I always enjoy Jan calls quite often on your behalf and your benefit, I might add. So it's always a joy to hear her voice, and I'm glad to talk with each of you today. So again, my name is Susan. I feel free to interrupt me if you have questions. As Rebecca mentioned, raise your hand. I'm eager to answer whatever questions you have. Do know, though, that this is a learning measure for all of us. You know, I've been working in public health for 20 years. I worked in food service before that, and I have never had to deal with COVID-19 or this level of a pandemic before. You know, I've been through H1N1 and other flus that we've had that have caused a lot of illness, but never have I seen it affect food establishments as much as this. So I just first want to say I appreciate all your work. It's been a heavy lift, I think, and all of us are actually excited to start to see us to continue to work in successive phases and continue to expand food service. But know that one of the reasons why you've had so much extra toil and work is because people have identified what we've known forever is how much of an impact food establishments and groceries and essential services that you actually provide to our communities. And, you know, that's a pro. You know, it's obviously key cornerstone to our communities, but it's also sometimes a risk because we have potential to spread illness. So, you know, COVID-19 for us, we still have not seen that it's spread through food. So it's not generally spread through the digestive tract. It is still what we consider spread through the respiratory tract. So you'll notice that a lot of our issues are really focused on people sneezing, coughing, talking, that 6-foot bubble that we all want to protect so that you're not exposed to people that might have the illness. So we are working on guidance materials. We've shared them. So far, we've shared them through email, but we haven't posted them on our website. So if you have a copy, that is because of your partnership here with WFIA or your connections in general. So if you have comments or questions about them, I encourage you to ask. The reason why they aren't posted yet is we still have a few items that we're working on with the governor's office to try and get clarity. When they issued the phase 2 requirements, there was some language changes. They used words differently than we usually use in food service. We had some food establishments that had additional questions that were still looking for additional input. We just sent some additional questions in today to try and get clarity on a few items as well. However, I do believe one of the biggest things, if you've had a chance to review the document, is the concept of customer self-service. We put a hold on customer self-service to reduce touch points. So again, several weeks into the transmission of COVID-19, we started to pick up that we didn't see that it was spread through food. So we still don't think it's spread through food. However, we didn't want a lot of open contact points out in food establishments for people then to handle potentially their germs on that utensil, and then another person goes and handles it. So we did put a limit on customer self-service, and we're starting to open that up in phase 2. Phase 2 generally means that we have, availability of health care in our communities, that if people do get sick, we can send them and they should be able to be covered by routine health care, not have to, over limit and overburden the health care in that community. It also means that we have potential to do contact tracing. So if somebody tests positive for the illness, we can probably identify the people that they may have exposed, and then we can help them kind of stay away from the public for the 14-day requirement. Also means that we have a control over our highly susceptible population. So we are finding that we have a lot of cases, especially in our nursing homes and other centers. So as we start going into phase 2, know that the effort that you have put into this has helped to get us there. I mean, I am 100% believer in the community response to help us control this illness. So again, I really want to thank you for all your effort. But phase 2 does mean that we start to expand a little bit. And again, we really want to stay focused on the things that cause the most illness. And so for us, it's really going to be person-to-person spread with people that are within your bubble, within your 6-foot bubble. But we want you to, start expanding people's access to food through self-service, but know that it's going to require a bit more maintenance on your part. We're really going to amp up the contact disinfection of your surfaces. So what do I mean by that? You really want to make sure that all of your foods are protected with sneeze guards. Even though we don't think it's spread through food, we can't rule anything out. So we will really want to make sure that your sneeze guards are intact. Really want to have people have direct monitoring. Technically, self-service bars are required to be monitored. I want to make sure that you're really getting employees that are tasked to the monitoring of it, because if you have customers that are touching the food or they drop a utensil into the food, then it needs to be fixed immediately. So really focus on how you can increase the monitoring of a customer self-service bar. Obviously, other items, you want to make sure that you're looking at anything that's a potential touch point. So anything that a customer routinely touches. So it might be a handrail, it might be a utensil, it might be a lid. All of those items need to actually be sanitized and disinfected, actually a stronger concentration than sanitizer. And we're looking at hourly at phase 2. So again, encouraging you to look at ways that you can, increase your food service. And if you do want to look into the customer self-service, and that would be items such as salad bars, olive bars, also your bulk foods. We are looking at that again, and we are conversing with the governor to make sure our guidance is what the governor's office intended, and then we are encouraging that. But it is going to require more monitoring, employee oversight, and then also disinfection of the touch points. So again, things that people handle directly with their bare hands. So let me make sure we're on the same page. When I use the word sanitize, that's usually what you use on your food contact surfaces. So back of house, where you're washing dishes or washing any of your equipment in the back, your cutting boards, that's a sanitizer strength concentration. It's food grade, so that means that it just evaporates off and you don't need to do anything more to that surface. It's actually edible at that point. What's unique is when you use a disinfectant concentration, as you see on the label, it's obviously a lot stronger. So you want to be more careful with that. Make sure your employees see the difference as well. It's not advised to spray things on an open food service bar if you actually have disinfectant strength concentration, because that actually is not going to be something that would be considered food grade. Disinfectant actually needs to be rinsed off if it's used on a food contact surface. So it's going to require quite a bit of an education switch if it's something that you haven't, gotten your employees, if they're used to, okay, disinfecting here, but if they're not used to doing your salad bars anymore and disinfecting those, they have to be retrained on that concept. So I didn't mean to steal your whole show though, Jan. So I did want to talk about the customer self-service. Mm-hmm.
I want you to go ahead and steal the show. You are the show.
Oh, okay.
No,
okay.
You go ahead.
Well, I wanted to mention a couple of other items. And again, if you have additional questions as we go through, I'd encourage you to chat. I seldom get an opportunity to talk with you all as a group, so I want to take advantage. I wanted to mention, you'll see when you review the requirements from the governor, but also our recommendations from the health department, we talk about using hand gel. I think a lot of you are pretty familiar with that with your clerks, where you're like, oh yes, no, we've been using hand gel ever since all of this came about. It's rare in food service that we actually encourage the use of hand gel. I'm sure you realize that we are like, no, hand washing. And for food service, so things that are greasy, things that have bacteria from animals or from people, or things that are spread in back of house, we really do want to focus on hand washing. But for things that are spread like COVID-19, which is through the upper respiratory tract from coughing and sneezing, we do believe that hand gels are actually effective. Now, I don't know if you're having any kind of supply chain issues. That's usually what I've been hearing about lately, is people are like, we don't have access to it. So maybe you're only having it for your employees, because like we have very little. It is going to be one of the recommendations to, allow that when you have additional customers coming in for a lot of hand contact kind of things. So they're coming in now, they're not just, taking packaged foods that you provide to them. Now they're coming in and they're dispensing it themselves. Really going to encourage you to use hand gel in those situations. So let's say you don't have access to it because we don't have enough supply. If that's an issue for you, the FDA does allow the use of the products that are produced by distilleries. So if you're not familiar with that, we have actually 37 distilleries in Washington state that I know of, from east to west, north to south of the state, that are producing an FDA approved hand gel. And it's ethanol, it's ethyl alcohol. It's about probably 80% ethyl alcohol, and then they add glycerin and a couple of other things to it. And they have a required label that they're supposed to use. So if you're interested in doing that and providing that, it's effective, it's a good substitute, it's allowed to be used for your hand contact. What's unique about it is it's a liquid. So I just want to be sure that you're careful, because if you're used to using the products that you probably buy from your supplier, that's probably more of a gel. So those work great in those, hand gel kind of systems on the wall. You put a liquid inside of that, it'll probably drain out. So this system, if you use those distillery produced ones, it's generally sprayed on the hands. So I just really want to get you, as you start, continuing to grow in this environment. I'm sure you've learned a lot of lessons already of things that worked and things that didn't. This will be something, if you're going to start looking into that, it's a great opportunity. We have a lot of, again, 37 distilleries in the state that are making it, but know that it's going to add a little bit onto you, because it's probably going to come, which is difficult to. Quite a bit is anything about saving of materials that you're using. So I don't know if you're having issues with your sanitizers or your disinfectants, if you're having difficulty finding those. One of the big concerns that we have, obviously, is you're such a key player in our communities. You use the same materials in a lot of cases that our medical community uses. And so right now things are, especially from a lot of providers, things are being rationed to the medical community to make sure that they're protected. So you might have, products that you routinely got before that might be a little bit more limited. So I'm sure you're all very familiar with the supply chain issues that we have. But know that we can potentially help you if you're having difficulty or finding some, substitutions that will work. One of the things that I gave to industry at the very beginning, actually, it was a smaller food establishment up near the coast in very western Washington. They were having difficulty finding any kind of chlorine bleach or anything else, and so they went to their home improvement store and found something called outdoor bleach, which, if you're not familiar with it, it has detergents added into it. It's really designed for cleaning the exterior of houses, but they wanted to use that. And that was not a safe substitute because it wasn't food grade, but we did talk to them because they were next to, this place that did a lot of distillery, and so they worked with that provider, and they actually used some different sanitizers that are approved for other kind of food operations. So again, if we can help kind of alleviate any of your stress, or if you're like, we have an issue here, we found a good substitution, I'm always eager to hear about that. Another question that we received a lot, if you've been watching the governor's proclamations, day in, day out, like I think a lot of us are, early on, one of the concepts would be that the face covering would be required for required for customers. And, that did, the way that recommendation is now is that it's recommended for customers when they enter a food facility. So it's not required that a customer has a face covering. It is, however, required by L&I that your your employees have a face covering if they don't work all by themselves. So that was one that we received quite a few questions on. One of the questions, too, that we received, and we pushed for this to try and find an alternative, an accommodation. So again, it's a requirement for employees to wear a face covering. That could be a cloth, a 2-layer piece of cloth. It could be a mask that you provide, but it could be something that the employee provides as well, if that's an option of yours. So we ask, especially in food service, we have people that work in high heat areas, they work in high humidity areas, they handle a lot of water, a lot of, they're just in high intense kind of environments, sometimes back in the kitchen. And so we asked L&I, is it possible to use a modification? Can they use a face shield instead of a mask? And a face shield, if you're not familiar with one of those, it's just a clear plastic that covers your entire face. Goes all the way down to your chin, goes pretty much to each ear, and then that way, if you talk or you cough or you have any kind of, you do anything that's going to spray your saliva, it should be caught on the shield. And so we asked if that would be an approved substitution for the face covering, and L&I has informed us it will not. So they are really gearing toward everyone that's an employee has to use a mask if they're working with anyone else. So again, if there's more information we can give on that. Mm-hmm.
I'll jump in because just before the webinar started, I was on the phone on a lengthy call on this very issue. And I said, you can't just say cloth mask because it doesn't work for some of our members, and I suggested that they go back and talk to you, Department of Health, and try to figure something out as an alternative. But so she appreciated that and said she'll take it back to their management and rethink that what is a good alternative. So maybe you could help them, because we have been told prior to today for those employees that have a medical issue, either mental or physical, that can't wear the cloth mask to get them a shield. So it's confusing.
I might reach out with you. Yeah, I might reach out with you offline, Jan, and figure out who you're talking to, because that might help us, because we've tried this angle, because the CDC actually has recommendation to use a face shield for medical if they have no access to a mask, a surgical mask, or for them it's a medical mask. I mean, it's actually a filtering mechanism. Ours, the face covering is purely a droplet spread. It's not designed to stop the virus from getting in through the layers. It is designed to capture whatever we sneeze or, cough out when we're talking. So yeah, we are definitely working on that because, again, the CDC has provided that guidance. You mentioned quite a few of them. We have concerns for employees that are claustrophobic. They have skin issues that they can't handle the tactile sensation. We have some that are asthmatic. I wear them when I'm out, and I'm a healthy person, and it does restrict your breathing. So for anybody that has a potential heart issue or something like that, there could be some concern there that we want to make sure we're addressing. And we just want to make sure we're doing it, with a way that works, so that people are taking the precautions that'll help us long term. We want something that's sustainable as well. And so we are working on that. So I will reach back out to you to talk who you spoke with directly.
Okay.
And another thing that came up that I hadn't really thought about, and I'm sure you all have, because you're like, oh no, we've been dealing with this for a while, but I was asked about checking IDs. I just got another webinar with our winery groups, and they're like, how do we do that? And I was like, oh, that's a great question. And Liquor Cannabis Board, if you haven't seen it already, has actually issued a memo that they posted on the internet. And it gives you some examples of what to do. So one of the ones that I thought was very appropriate is, the concept would be that they would have a person leave the ID on the surface, the employee could look at it, and then the person could step back and then slowly, remove the mask for a couple of seconds and then put the mask back up. So the key is that you would separate by the 6 feet, just have them step back and you can visually check. They also provided the concept of if you're unable to do that or not able to step away. Now this one's kind of strange, but I was like, well, I thought it would work. Scientifically, it would work, I think. The person would hold their breath when they removed the mask. So again, I know these kind of sound like, man, every little level is, trying to be controlled. And that really isn't the design. We're trying to put as many hurdles as we can, both to protect the employees, but then also to reduce the spread in our community. And every little part that we can do will help reduce the risk. And not only that, it helps people, I think, modeling good behavior. They see, it's like, oh, okay, now I see what they're talking about. Because if we make these, exceptions, for things at certain times, it's going to be confusing for people. So I think they had some good concepts. And again, if that's something that I need to share with you, but it's definitely available online from the Liquor Cannabis Board if checking ID is an issue for your staff. I want to be clear too about the buffets and salad bars. We really want people to focus on the touch point disinfection. But again, we don't see that it's the most likely risk of exposure for people. The CDC just recently kind of altered their risk of transmission chart, and they knocked that one down a little bit, and they kept the person to person, by breathing in somebody else's space. And so as you're working with people, we try to really focus and go, this is your biggest risk factor here. And it's not just working with customers, it's, your coworkers. We really want to make sure that people are able to do this, back of house, front of house, on breaks, at lunch, at all times. The biggest concern that I had early on with this virus, it's rare for us to have a virus that can spread before you're symptomatic. We have a few, but many of them are not spread this way. And with some of our other ones, like Ebola, we hear about that one in the news a lot, and like, yeah, but you have a lot of symptoms before you're actually able to spread the virus. This one's unique. We can have it for 48 hours before we can even spread, or before we even show symptoms. And the percentage of people that are asymptomatic but able to transmit is, about 30 to 50%. So you can have people that have absolutely no symptoms at all, and they're able to transmit the virus. So we really want to drive that point home, that we want to do as much as we can to reduce that person-to-person exposure, so make sure that bubble's good and intact. Now, another one I wanted to mention was the daily log. And that one, that's the part where you have to keep a log to include the customers that dined, when they ate, contact information, their name, at your facility, and you have to keep it for 30 days. When that first came out as a requirement, and if you look, I believe it's still listed as a requirement. Let me look here.
They
the governor
changed it.
Oh yeah, no, they did. I see
did.
that now.
Yeah. that.
Yeah. So it was listed for quite a while. As an actual requirement. But again, they've issued guidance. It's available online. It's in writing. It's a memo from the governor that was issued on May 15th. And he clarified that, no, the business doesn't have to require that customers release that information. However, they still are required to keep the log. So your business should have the log. And then if a customer wants to provide their information to you, then you would be required to record that and maintain it for the 30 days. So, one of the questions I had on my last webinar was, how proactively do I need to do this? And I was like, oh, that's a great question. So to me, you have to have access to it. And my primary would be make sure all your employees know about it, to go, if anybody asks them, hey, I want to leave my contact information, they're like, okay, yes, I can take that and put it on the log. That your team knows that log will be kept for 30 days. It'll be destroyed after 30 days. It probably won't be accessed by the health department unless they have somebody else that reported illness associated with that facility. So it is required to be kept for 30 days. Now, one of the things that I liked that I saw that Oregon was doing that I'm going to look at to see if it's something that would be helpful for us here in Washington for industry, is they had a simple sign that said, we have a log if you want to keep your, provide us your information. That was their total education on it. And I think something like that could potentially work. But again, there isn't a requirement in the governor's materials that says you have to proactively reach out to people and ask if they want to be on the log. However, your staff does need to know, yes, we do have a log, we maintain it. Here's what we need from that person if they want to leave their information.
Susan, would you explain, because we have a lot of convenience stores and even in our deli seating area, they have beverage bars, and most of our solid bars, hot bars and stuff have the sneeze guards. But I am trying to visualize how a sneeze guard goes up on a self-serve beverage area and still reach and get your beverage poured.
Yeah, so we haven't heard that people are requiring a sneeze guard to be put on a containerized service unit. Have you heard that, Jan? Have you been required to do that?
No.
Okay.
You haven't talked about the beverage bar yet. You just talked about the self-serve with the sneeze guard. So I wanted to get some real clarity here, because we have a lot of people on the line that have self-serve beverages.
Yeah. So we've I will ask the rest of my group this if I'm missing something, but we don't see that that's going to be a big contamination factor. So let me explain kind of the difference. So when you have a salad bar, you have a lot of food that's left out that people can probably access. However, when you have a fountain drink or a milk machine, or you have a water dispensing unit, those are, the bulk of the product is actually internal to the unit. And so there shouldn't be really any way for the customer to access it. So, things like that. And then when they open it and it comes into their cup, then that is whatever they've done to it. So as long as you're doing the social distancing, which we do want to encourage, that you're doing some sort of a system so that you have people that are up there 6 feet apart. So if you have a fountain drink system that only has 4 taps, that's probably one person at a time. Versus if you have a fountain drink system that's separated by, a pretty big structure that usually holds napkins or something, then you could probably have 2 at that one. Now, another item that's unique and that's going to add a little bit onto your employee tasks is our guidance is not to put the paper cups and lids and straws out there in the customer area, to actually have your employees hand them those products for them to take with them. That way they're not, handling other people's lids and such when they're out and about. So that would be another concept. But I don't see the need for the salad bar kind of sneeze guard on something that's containerized like a fountain drink. But you do want to make sure you're doing the touch point disinfection, so wiping that down with a disinfectant. And then also, keeping the paper cups and straws and lids behind the counter.
So the self-serve, like donuts and hot dogs and stuff, because they have the plexiglass and you lift and you reach in with the tongs and get your donut or your hot dog, that's considered a sneeze guard for those items, and the beverages would not have to have that specifically. And in all cases across the board, all those extra self-serve condiments and disposable serviceware has to be behind the corner and dispensed. Correct?
Mm-hmm. Mm-hmm.
Okay.
Yeah.
Good. Okay.
And
And we're at phase 2 now in what, 18 or 20 counties? Quite a few. I lost track over the weekend. So our stores that are in those phase 2 counties right now can start implementing this, correct?
yeah, so if you've been looking at those requirements, it requires you to have a written plan and how you're actually going to be able to implement all of this. So, just because people roll, and I think this is really key, both for the ones that are close, but maybe the ones that are already operating, just to make sure that we're all on the same page, that you can't just automatically open as phase 2 because your county does or the state does. You actually have to be able to address every one of those considerations and the governor's requirements in order to actually open. And one of the biggest items is you have to have a plan. I was on the call just a moment ago, and LNI was also on the call, and they said, well, every business has to have an operating plan for their safety, and I appreciate that, but at the same time, it may not be something that everyone has written or has available to them. So do please pay attention to that concept. It's not just because we're at phase 2. It is like, oh no, we're at phase 2, and I have this plan that meets all of these requirements. People have asked us, well, can we have just a generic plan? We have a checklist that I think we've shared that kind of helps, but it really is going to be unique to your operation and your facility. I think that checklist and the guidance materials that we have will help you kind of identify in your areas where you also need to flesh it out a little bit. But yeah, you are required to have the plan. Now, here's the other part of that, and this is a question that we get a lot, and we're trying to find the solid answer. This is such a moving target for us. I have a feeling that every single one of you on this call knows this, but I'm going to say it out loud as well. Washington is what we call local control. And so what does that mean? It is in our state constitution that your local health departments have jurisdiction. So while we provide guidance at the Department of Health for food establishments, the local health authority is the authority. And so we're working with them to make sure, we shared the guidance that we provided in advance so they can review it, make sure their health officers were in line with the guidance. We're comfort level for people because some counties especially had a lot of COVID-19 cases, and so they are really trying to make sure that they do not poke back up, that they don't increase, so like they might have additional requirements to go here, we're going to hold off on this. So this will be information that I can share with Jan as soon as we have it. We're reaching out to all the counties just to go, okay, let's make sure we're all on the same page. The situation continues to grow. We want to make sure that we're all, continuing to go, yes, at phase 2, we're going to open self-service at this level with the increased disinfection.
Okay, Susan, we're getting some questions building up here, and I'm going to have Rebecca unmute people. Please, everybody put your own phone on mute while Rebecca unmutes you. And Rebecca is going to read the questions that have been gone into the box, if you could answer those. But I will remind the membership, and I see Mike Latham has finally got his login to work, but last week, I think it was last week, they all go together. Town and Country Mike Latham shared his written operations plan, which covered most aspects, and he left it so you could generically fill in. What we'll do is go in, and maybe Mike will even help me, we'll go into the section on self-serve, because there are a few new things here, and we'll try to beef that section up and repost it, and then you can take it and modify it according to your own service. So we'll try to help you with that much. somebody does not have their phones muted. So Rebecca, are you able to read the questions, or you want Melissa to? What are you?
If you want me to go down the list on muting people, then Melissa should probably read the
Okay,
questions.
is Melissa unmuted?
Yeah, I'm here. Can you hear me?
Okay, yeah. Could you go with the questions, Melissa, so Susan can respond?
Sure. The first question is, do we have to keep the SDS for these alcohol-based hand gels for 30 years?
I think that
I don't know what that.
I will. I'm not trying to. I'm like, I'll have to look. So we did get clearance from the FDA that they could be used as a replacement for hand gel that you normally buy, that you do have, you know, all of the SDS and all of those approvals. And they're very specific, though, that it has to be following a certain recipe. So I'm not sure if that 30 years was by design, but I will check to see if there's additional paperwork requirements for those hand gels. I'm not familiar with anything, though, no.
Okay, Melissa.
The next question is that one of the members recommended the breathable neck scarves that can come up and over the mouth and nose. Is that acceptable?
So that's another question that we asked L&I to see what kind of modifications that we could make. So I think those are commonly called a gaiter, you know, where it's something else that could be worn. So that's another one that we'll have to follow up, because again, we provided quite a few, you know, comments for accommodation, and I want to follow up on that after I talk to the person that Jan talked with, because our initial responses back were, no, it has to be, you know, this or this. So I want to see if we have any kind of accommodation there.
Okay. The next question is just for clarification. Did I hear correctly? L&I is saying our employees must wear face masks.
Yeah, I want to be clear, though. It's a governor requirement, and it's also by L&I, so Labor and Industries, and it's when they are not able to work alone. So if they work in an environment that they're the only ones there, they're the only ones that use the equipment, then they don't need to use a face covering. However, if they work with employees or customers, then they do need to have a face covering. And I want to make sure I'm clear about the difference between the two. A face covering is something that is generally 2 layers of cotton or fabric. It can be provided or made by the person. It doesn't have to be something that is, you know, approved, like they use in medical facilities. So usually we'll call that a face covering to differentiate. A mask to us is either a surgical mask or an N95, you know, the respirator that actually does do some viral filtration. Those are really destined for the medical community, so we don't have a lot of access to those necessarily, but they are a little bit more protective. So sometimes you will see like a surgeon's mask, that would be considered a mask, versus a face covering, which is generally 2 layers of fabric that anybody can make.
Susan, this is where we're getting conflicting information, because the call that I just got off with L&I before I jumped on this, because one of our staff had understood that they were saying it's required, and she goes, no, we're not saying it's required. We are just preparing our documents. So if the governor requires, rather than strongly recommending, that we have the guidance necessary. And she also said that they will be implementing their DOSH penalties, $9,600 for a business that is not complying, but that would be after warnings and educational touches. So I'm not sure if L&I has 2 different sections of L&I saying 2 different things, but you and I will get together with the person I am talking with, is the person over all rules and regulations and the liaison to the governor's office. So we will clear this up, because the same thing happened with us. One of our staff understood L&I to say required. When I followed up, just before this call. She said no, but if required. So we have a lot of confusion going on right now with Elle and I. So
yeah, and I don't want to add to it, but I mean, we've been pursuing this for a couple of weeks to get an answer in writing.
Yeah.
So it would be good for us to be all on the same page with that.
It would. It would.
Those partners. Okay.
Do
We do. We have several more questions.
Okay.
So just more clarification. Are you saying the hot bars and salad bars will be allowed to operate under phase 2 provided stricter regulations are met because the governor's requirements say otherwise?
So the governor's requirements, here's where we're working with the governor's office. They say buffets and salad bars are not permitted at this time, but may be addressed through subsequent interpretive guidance. And so we've issued subsequent interpretive guidance. And so we're trying to say, okay, is this, meeting what all of your intentions were? So, we are confident with the interpretive guidance, but we're just trying to make sure we go, yes, this is, to the level that they would like it. One of the concepts is the timeliness of responses, to a lot of these. I know you face it as well. But we're sitting there going, okay, let's make sure that we are, on the same page with these requirements that were issued. So we're actively trying to get the full responses, make sure that they concur with our guidance. I think on top of that, again, the biggest issue I think is, or a good portion of it is going to be is how to control so you don't have a lot of people at the unit at one time, because you're still going to be required to maintain that 6-foot bubble between people. So I think the guidance though that comes from CDC, that they reduce the likelihood that the virus is spread as much through touch points as it is through person to person. So I think that helps also to defend the concept of restoring the buffets and salad bars. Early on, we weren't sure if it wasn't spread through food. There are, I don't want to confuse the issue, but there are gastrointestinal symptoms. I'm sure you've seen that, where people will say, I had diarrhea from this, I had vomiting from this. So we know that the GI tract can get, the virus can, infiltrate. So it can cause some reaction, localized reaction. We just don't see that it's necessarily going to spread in large quantities from a person that's infected that way. So that goes a little bit above and beyond, I'm sure. But we do want to make sure that we're on the same page with the governor's office and that our guidance is meeting what, he intended going forward. So we believe that the guidance is meeting his intent. I agree with you where it says it's not permitted at this time, but we're going with the maybe addressed through subsequent interpretive guidance.
Okay.
Hey, Susan, this is Mike Latham, if I may jump in for a second. Susan, I'm sorry that I missed most of your presentation. Certainly, you and I talked earlier today, and I had a lot of questions. But one of the things that I just wanted to ask you, based on CDC's current thoughts on the spread of COVID-19 and not being as concerned over touch points, is that the logic behind going to every 4 hours wash, rinse, sanitize of utensils and only doing the cleaning up once a day in your document instead of every couple of hours?
I'm going to have to look at the document. I thought it still had an increased frequency. So let me rephrase that. So we were notified. Well, it hasn't been linked to food, and actually all coronaviruses. So when we had MERS and when we had SARS, they weren't linked back to food, exposure either. It was really person-to-person kind of exposure where we found coronaviruses being spread. So, early on we were trying to get people to do touch points so that we could reduce that, but we didn't think the food was the issue, consumption of food. It would be because you're breathing in the food while you're sitting there next to somebody that is actually infected, when you're actually breathing and eating because you're sitting in a space for a long time. So our early guidance, and that's the part that we need to address and adjust. So our early guidance was you didn't need to close down salad bars. It was like, no, just do your 6 foot separation, do your touch point disinfection, and that should be sufficient. However, some of the counties especially elevated that. So just along the I-5 corridor, where they had more cases than other counties, their health officer went above that and said no salad bars, because they were trying to make sure that they really tightened down on the spread of the virus. So our early document, I think, is the one that you're referencing there. The recent one that we sent off for phase 2 guidelines, I'm pretty sure indicates a frequent disinfection of touch points, I think hourly.
Okay, we have a lot more questions.
We do. So the next question is, for grocers that have in-store seating areas where people eat, are they required to follow the restaurant restrictions for phase 2 for eat-in service?
Yes. I can expand on that if you'd like. So yes, so what that would be is that they have to be separated by 6 feet, and it's not the tables have to be separated.
Rebecca, can you close that off? Thanks. Okay.
Yeah, it took me a minute. I got it.
Thank you. Sorry about that. So it's not that the tables have to be 6 feet apart, it's the consumers have to be 6 feet apart. So your tables are probably going to be 8 to 10 feet apart, because it's when they're seated that their seat has to be 6 feet from the guest at the neighboring seat. So yeah, so if you have on-premises consumption, you're restricted the same way that restaurants are. The other part of that, and I know Jan and I have talked about it, is that 6 foot distance is likely going to be less than 50% of your capacity. It's probably going to be substantially less than 50% of your capacity. So I don't want you to think that you can have 50% of your capacity and go, yeah, I had to shove, some additional people here. It's like, no. They all have to be 6 feet away from each other. So that's going to be the requirement. I hope that answers the question.
Yep. And we're starting to get short on time, so I'm going to jump to these other questions here.
Okay, can olive bars mirror salad bar guidelines?
Yeah, it's the same concept.
Okay.
So yes.
Where is the checklist that you had referred to, Susan? Or does WFIA have that?
I have it. I just didn't post it because it's 787 is not for us, but I'll go ahead and send it over to Melissa to post.
I do want to add on to that, though. When we prepared those guidance, Jan asked for something that was more specific for grocery. So we've been working on grocery guidance, and that would include convenience stores, other food establishments that kind of have a similar market style. So we are working on that. That might be more appropriate and applicable to you all. So I can appreciate that checklist may not have worked for your groups. However, we are going through it and making sure that we get it kind of set up a little bit better for grocery and market kind of.
You're awesome, Susan. Thank you.
Well, thank you. That's nice of you to say, but it's okay. That's my dog chiming in. He agreed with you.
So just a couple more related to this topic. If an employee cannot wear a mask for medical reasons, does that mean they can't work?
Yeah. So I appreciate these questions. But I really think that we need to circle back with L&I. So because we had the same question with the original person that was answering ours, and their concept was that they need to change their job. And not that they have to go to a different job, but they would have to change their details so that it would be something that they could do so they were separated away from people. So we're going to try and come up with some modifications there. And traditionally we call them accommodations because, it is kind of a standard of operation. So we want to make sure we're getting those answers correct. We just need to reach out to L&I again on that. Sorry.
And I'll invite L&I for next week, everybody, because clearly we have a lot of work to do for clarity.
Okay, last question in the question board, and then it looks like Andra has her hand raised. So the last question is, do employers have to provide the face coverings?
Okay, so that's another question that's perfect for L&I. So Let me kind of explain that a little bit. When it's required for personal protective equipment, so a face covering technically is not personal protective equipment. That is not something that we would give to medical providers so that they are not exposed to the virus. However, when it's required for an operation, then LNI, from what I've gotten from LNI, is they're like, yes, they have to provide access to a face covering when they require it, and they're required to do it because of the governor's requirements. So again, that would be something that we should bring before LNI, but from what we've gotten from them is they're like, yes. Now, they can provide the option if a person wants to bring their own, that they can provide that, and that could be something. But LNI's general information on that, and again, I would encourage you to reach out to LNI, but is that, yes, if it's required for their work, then they need to provide it. The other part of that to consider is they need to be cleaned. If we're using a cotton face covering or a face covering in general that's reusable, you need to have accommodation to actually wash it. We recommend, daily after each wearing. So that's something else to figure into your cycle.
Okay, and again, I want to say right now, we don't have a mandate on us, but I just have a sense from LNI that it's around the corner, and that's why they're getting us prepared. And we did get a big shipment of, I don't know how many, 45, 50,000 masks that went into the warehouses that are in the process of being distributed out to our stores. I'm sure that's not nearly enough to cover y'all, but it's a start, and we'll keep working with FEMA for more. Okay, is there a last question there?
We do have one more question. If the employer requires face cover, do the DOSH respiratory protection guidelines for medical evaluation apply? I'm not sure if you answered
that's for LNI. That's for
okay.
LNI.
Yeah.
So
okay.
Yeah.
We also, Carolyn has her hand up.
Well, Andra does too.
No, Andra put her hand down.
Oh, she did. Her question got answered. Okay, yeah, Carolyn, if you could hurry, because we have some other business to take care of.
I'll be very quick. I've just had several conversations with various people at LNI and the governor's office that yes, because these things are ending up being employers required, or employees are being required by the government, the employer will have to provide the masks. I've had that confirmed in many, many locations.
Yeah, if it's required, we will. If it's strongly recommended, then no, but we're still making the effort. Okay, we've got, as I see it, maybe 7 minutes left for a few other updates here that are quick updates. So last call, and Susan, anything else that you think is important to share?
Carol Hawkins.
No, I just.
Sorry.
Okay.
Oh, she put her hand down. Sorry, never mind.
Okay.
We scared her off. No, I just really want to thank you again for all your work, and you guys have been really great partners with us, both with the Food Safety Advisory Council, and yes, I am eager to talk with you all about the changing food rule when we have a dull moment or a spare moment. And if you have any questions, again, both Jan and Michael are the ones that I primarily speak with, but of course, I'm sure your entire team can give questions to us, and we'll do our best to try and make sure we're consistent between all the state agencies that you work with, trying to do our best for your people just like you are. So again, Jan, thanks for the time and for helping me get to be able to speak to your group, and I guess I will sign off unless you have additional things you want me to stay on for.
Nope, I'm good, and thank you, Susan, for spending so much time, and I guess Mike and I will be spending 2.5 hours with you tomorrow for the food code, huh?
That's right. I get
Okay.
payback. All right, I'll talk to you guys tomorrow.
Okay.
Bye-bye.
Thank you so much.
Bye-bye.
Bye. Okay, we're going to jump through some staff updates, and the first one I want to go to is not on our staff, but on the staff of Ern West, and he's head of all of our safety training. OSHA did a brief update, and Mike, can you hear us and talk? Okay, great.
Yes,
thanks, Mike. Mike Octave.
Good afternoon, everybody. My name is Mike Octave, Vice President of Safety and Health with Employer Resources Northwest. I just want to give, due to time, just a real brief update. One of the questions that WFIA members ask a lot of is, are COVID-19 cases, are they OSHA recordable. And this can be, as we've navigated through the last 4 or 5 months, this has evolved over time. OSHA's stance on COVID-19 is it must meet 3 criteria. Number 1, it has to be a confirmed case, so positive case in the workplace, or it has to be positive. Number 2, it has to be work-related, and number 3, it has to meet the definition of was there a fatality involved, days away, restricted duties, or medical cases beyond first aid. And the one question that really sticks with people is it work-related? Because how do you determine that when you're in the general public, with cashiers and people dealing with the public, in front of everybody? So recently, OSHA came out with some specific guidelines or guidance. It hasn't changed the case of work-relatedness. It just provides some insight to help employers help identify to see if that is the case. So basically, in a nutshell, if you have an employee who has had workplace exposure, what you need to ask yourself some questions such as, has the person worked amongst others? Have you seen a cluster of employees test positive in the workplace? And so if you can, if that is, the employee was exposed to a cluster that happened in the workplace, there could be there's some guidance there on that. Also, if there's any, if the work duties require the person to be in close proximity with somebody who has tested positive, that would also, require a case to be reported on the OSHA log. And there's a few others, and again, for the sake of time, I'm not going to go into them, but they have, just as of today, have provided some guidance on that. The other real quick point I want to point out is reporting versus recording. There's a lot of confusion out there on when do you report a OSHA or COVID positive case that's work related to L&I in the department. And so basically, under the reporting process, if you do have a workplace tested positive COVID case that has been identified as work related, and that person seeks medical treatment, and as a result of that is inpatient hospitalized, then you would have to report that to L&I within a required time frame. And so there's a number that you would call, and they would take that case. So I wanted to provide some clarification there on when that is expected, and kind of on as this evolves, some of the updates involved. So thank you for your time.
Okay. Well, thank you, Mike. You are always such a hero for us in the area of workplace safety. So the document to that link that you and I exchanged today, is that the document we need to post for our members?
Yes.
Okay, thank you. We'll get it up there and get it posted. Thanks so much, Mike. Next, I want to jump, and I did see a question come through on the 30% occupancy. So far, the governor's office is not budging on keeping us in the retail reopening at occupancy of 30%. I know some of our members called the office, but I think many of our members did not take the action to call the governor's office, because they haven't mentioned to me that they were overwhelmed with emails or calls. The only thing they mentioned is we did have a few pretty influential legislators call on our behalf, and they did mention that. So once again, on our website today, I beg of you, if you have not called the governor's office or sent an email to oppose us being included in the 30% occupancy, I would ask that you do. And then Kat and Carolyn, being our ledge team, are going to be following up with more legislators to see if we can put more pressure on the governor's office, because it's really inequitable, inappropriate, and not happy about it. But for now, it still stands. So now, Kat, meat advertising and the Attorney General.
Hi, everyone. This is Kat Holm, your legislative director and legal counsel. Just a quick update. So, as most of you know, how the meat that you have been getting is not the amount of meat that you normally have, and so your ads may not be correct. And so we had reached out to the AG to see what we can do, because it is a violation of the Consumer Protection Act if you have meat for sale and you advertise it for a certain price, but then due to the meat not showing up or the meat price increasing for you up to 300%, as we had seen, then you cannot put, then you would not want to sell the meat for the amount that you advertise for. The AG has given us some guidance on that. And so generally the failure to honor advertised prices can be an unfair or deceptive business practice. But in deciding whether to take enforcement action, the AG Consumer Protection Division looks at the total circumstances regarding the potentially unfair and deceptive conduct. And so they would take into consideration circumstances that are outside the retailer's control before embarking on litigation. So if a retailer advertises a certain price for meat when there is good reason to believe that the price may go up due to the current meat availability issue, then the AG is more likely to want to enforce it versus someone who is just reacting to the price increase. And so in summary, if you have high meat prices on ads that were submitted several weeks ago, they would most likely not do the enforcement action. However, I would not recommend running meat ads for a while until the supply chain has the opportunity to correct itself. And so if you are thinking about doing meat ads, I would maybe kind of wait a little bit and then go from there. So let me know if you have any questions. More than happy to answer them or find the answer for you.
Okay, thank you. Tammy, was there any update on the UI false claims?
Yes, actually there is. I've been working with a law firm here in Seattle, Lane Powell, and I got just a little bit more guidance from them. I shared our tips, and actually there's a new site that has been set up, and I've put it on our tips, and we're working on redoing those right now as we speak. But in there, it will give you guidance on how to report everything. And so the additional is the identitytheft.gov website, and they'll actually guide you through the whole process and help you on this. So just check out our website. We've left it on the new today, new this week, on those tips on how to report your fraudulent UI claims.
Okay, thanks. And the other new scam is because contact tracing has been implemented in our state and some other states. Of course, the crime rings have thought of a way of doing that, and what they're doing is sending out text messages to people that is saying you've been identified as a potential person with exposure to COVID, and we need to talk with you and give you more details. Click on this website, and you go click on the link, and it sets a virus up into your phone system and captures all your financial information. So please let your employees know, and of course for you, that you are not going to get a text message from the National Guard who's doing the tracing. You'll be getting a phone call. Don't answer a text message. And finally, one other question, I saw some confusion on, still confusion on how to calculate your 30%. Take your square footage of the area in which your consumers, your customers are allowed to be. So don't include your backroom, storage, shipping, your prep area. Don't include those areas as square footage. Do your square footage of where your customers are allowed. Divide it by 60, which is the fire code maximum capacity. When you divide that square footage by 60, that is your maximum capacity for the public. So then you take 30% of that amount, and that's how to apply the 30%. When they increase it to 50%, you'll use that same formula, but go 50% of whatever your maximum capacity is. And if anybody is still having difficulty, please give me a call. I will help you walk through that. I think we have nothing else. Do we have any other questions? Okay. Kevin, I know that you're the one looking for that checklist, but I think I'm going to wait and get it from Department of Health so we don't cause a whole bunch of confusion, because it's just telling you how to restart your refrigerator and restart your stoves and that kind of stuff. And we've been operating, and that's why I didn't want to post it. So thank you all for joining us. Once again, it's been great. And if you have any suggestions for next week's webinar, please send us that suggestion. Oh, Pam and Ray, do you guys have anything that you wanted to say about the masks being distributed out or not? I don't know if you do.
Let me make sure. Oh, Ray, neither one of them are able to talk.
Okay, so FEMA did come through with some, and we will continue to work on some more. So your standard delivery will hopefully include some masks for you, for your employees. So, okay, y'all, thank you so much. Thank you to our staff. Appreciate it. We'll see you next Tuesday, and I will try my darndest to get Ellen and I lined up. Appreciate it. Have a great week.